So, what I'd like to talk to you about now is it really dovetails with what Samantha was just talking about, and is very much around the practical elements of exploring and implementing a family hub. So, any of you who have implemented any sort of transformation within a council will know that there are a number of ways in which you can explore it. But I think for family hubs, this makes sense to us. So there are three phases really. Explore, which is where you think of what the idea is, where you identify the problem. The business case element, which for most of you to get funding and to get an idea approved, you're going to have to develop some sort of business case. And then implementation. So if we start with explore, the first thing obviously is to set up a project team, and this has to have a small group of people who are really passionate about this idea. Then, importantly, you need to identify the problem and develop the vision. Now, for each different area, the acute problem that you're facing and trying to solve will be different. So you need to identify what the problems are, look at your data, identify what it's costing communities, what it's costing the system. Are there specific geographies within your area where the problem is most prevalent? And then you need to identify baseline. So what exactly is the problem that we are trying to solve here? And once you have that problem, you can get people together to start thinking about what your vision is. So what are we going to try and achieve by exploring this family hub model? So this is a little bit geeky as well. So the best place to start is to define what we call user personas and pathways. So a persona would be a typical example of a person or a family who is really struggling. And you would capture all of the characteristics of that typical family. And you may have a whole range of those personas. And then what we would typically do, we've supported a number of areas to do this, is to get a big table or a virtual table, which there's plenty of digital tools where you can do that, and to actually map out a typical journey of a person. So in a typical week, which services do they interact with? Which services do different members of the family interact with? What are the handovers between services? Where are the gaps? Where are the areas where once you've identified what that person or family's experience looks like, where are the gaps? And typically, if we weren't in lockdown and we're starting to emerge from that now, we'd be talking about a big piece of paper on a table with lots of post-it notes on it. And what that does is help you understand the existing and current experience that a person or a family has. Then once you've got all of that information, you need to think about what a better pathway would be. How could services work more effectively together to avoid gaps and to avoid areas where it's quite clear that a person is being let down? So you spend some time for each challenge developing what that ideal pathway looks like. And it's only at this point where you start to think about who needs to be involved in your family hub team, because through this exercise you will have identified which individuals, which services are required. And at this point, the exploration phase, what you really want to end up with is a high level design of what your family hub might look like, and be able to explain it to people and show that you've been through a proper process to ensure that it's addressing the problems which are particularly acute in your area. Then it's on to business case. And this is what we all need to do if we want to get funding. So there are a number of different models for business cases which different councils use. We tend to use the 5-case business case model, which is structured in a way that it answers the strategic question, as in how is this contributing to the overall strategy of the council, the economic question, which is how does this fare in terms of a cost benefit analysis, a financial case which looks at how much it will cost to establish, how much it will cost to run to make sure it's affordable, a commercial case, which is where you start to look at, do we need partners for this? And a number of our case studies today involve partners. So how is that structured? What contracts are required? And then very importantly, a management case, which is how on earth are you going to implement all of this? Because it is complicated. Then you'll need to share that business case with the key people who are required to approve this. So more than likely a decision maker in the council, perhaps somebody in the community health trust, perhaps somebody in the police, depending on what problem we're trying to solve and what team you've decided that you need to put a really compelling business case to them and be really clear about what you're asking them for and what problem of theirs this is solving. That's the key thing. And then a very important point to be clear about at this stage rather than later is that you are asking these leaders to allow their staff that will be involved in this to act in a very different way. So it isn't just going to be business as usual. It's not just window dressing around public services remaining within their traditional silos. You're asking these leaders to allow the teams that are identified to work together in a very different way, and that is absolutely critical. Then it's on to implementation. So to develop anything with success, you need a pretty detailed implementation plan, which will cover everything from the physical establishment of your hub, the transfer of staff, if that's appropriate, engagement with service users, but really importantly, and I haven't mentioned this yet, but it is a key thing all the way through, engaging with the frontline staff. Now, I haven't mentioned it up until this point because it may not be absolutely clear up until this point whether you have permission to actually engage with the staff who may be involved. So it could be that if you're piloting something like this on a small level, it's at this point that you start to put together your team. And the very important element of this is the right leader. So somebody who really believes in the model, somebody who is passionate about it, and somebody who has good experience of solving some of the problems that we're talking about here. And then it's on to thinking about who specifically would be on that team. And we would very strongly recommend interviewing people to understand whether they are the type of person who is willing to act differently and isn't just going to want to try and continue what they've always been doing and bring that into the team, because this does require a different way of working and a more collaborative way of working, and an ability to be willing to try things which perhaps don't work and learn from that and try something else. And remembering that we're probably dealing with problems that individuals and families have that nobody has been able to solve for years, possibly decades. So the idea of trying something and it not working is not the disaster that it might sometimes be presented as being within the public sector and every sector really. I think it's really important to keep it simple at the start. So don't let the perfect become the enemy of the good. This is a model that you need to just really get going with and allow it to evolve over time. So important thing is just to get started, start working with people, and your model will develop and any wrinkles will be ironed out over time. Then an important point is to focus on culture, and I've really covered a little bit of that already, about that ability to try different things, to support each other as a team, and to be willing to accept that everything that is tried may not work. And finally, and this goes back to the Doncaster example from earlier, it's really important to gather the data and track what happens. There's no point 12 months down the line realizing that you're now being asked if it's working or not when you haven't collected any baseline data and you're not collecting the right information as you go. So that was just a whistle-stop tour of an example of how you could explore a family hub. We've been through this process with a number of councils, and the result and the shape of the family hub has always been very different because the specific problems that they're dealing with are different. The environment in which they're operating and the level of existing collaboration between agencies, between the NHS and the council and police and others, is maybe starting from a different baseline as well. So it's a good process to go through, and the result will be a family hub which is very specific to your area.